Thank you, Mr. Chairman. Good morning to everybody. It is my pleasure to participate in this symposium, and I would like to thank the Scientific Organizing Committee for inviting me. My presentation will be about amblyopia screening. In this presentation, I will go through the definition and prevalence of amblyopia and discuss why it is important to screen for amblyopia, who is responsible for screening, and we'll finish with the screening methods, and I will conclude with recommendations. Amblyopia have been defined in the ophthalmology literature in different ways, and von Grief said that it is the condition in which the observer sees nothing and the patient very little. It is the reduction of the best corrected visual acuity. It is interruption, it will cause interruption of visual development during the critical period of maturation of the visual system in childhood. It will cause a binocular discordance of visual inputs of both eyes. It is commonly unilateral, but uncommonly and less commonly bilateral. Now, amblyopia considered to be a retinal disorder due to the structural and functional damage occurs in the lateral geniculate nucleus and striate cortex of the visual center in the occipital lobe in the form of atrophy of connections. It will cause a deficit in the contrast sensitivity and accommodation. At the same time, it is reversible visual deficit, usually up to the 7 years of age, because of the maturation of visual system. Now, amblyopia is caused by 3 important factors. It is a stimulus deprivation, like in high bilateral deprivation and bilateral squint, and bilateral cataract, for example, or with strabismus and with refractive and anisometropia. It's usually the amblyopia, as we said, it is unilateral, but can be bilateral with bilateral cataract or bilateral high refractive error. Prevalence of amblyopia is estimated to be between 2 to 5% among children, among the population, and it is considered to be the most common cause of monoocular visual impairment in children and young adults. In Washington National Study, they found that it is the leading cause of monoocular visual loss in people between age of 20 to 70 years. It is commonly unilateral, but bilateral amblyopia considered to be an effective blindness. Now, as you know, that early diagnosis and intervention may lead to better visual outcome, and it is well known that it will cause a bilateral blindness. Actually, if a patient loses the vision in non-amblyopic eye, at the same time, if the binocularity have a social and at the same time have a social impact on the patient. That's why it is very, very important to screen for amblyopia. Notre Dame study, they found that the life risk of bilateral impairment in people above the age of 55 is doubled by the presence of amblyopia. At the same time, life-threatening disorders may present an amblyopia. Who is responsible for screening? Screening of, it is an important health strategy, and the amblyopia screening fulfill that criteria for important public health strategy. The early detection is the key for effective prevention and treatment, and screening usually in many countries done by a primary care physician and pediatrician, which is usually done at the regular interval during vaccination. Preschool children, the primary care physician is the one who is in charge of the screening, but orthoptists, optometrists, and ophthalmologists also perform a comprehensive exam, and we call it the gold standard test. The prevention of amblyopia can be done through different techniques, and the techniques would be varying degrees of specificity and simplicity and sensitivity. Children at high risk of amblyopia have to be watched closely with an early signs of this condition. And early detection, the quicker detection of amblyopia, the less negative effect in the visual system. Now, eye screening, usually a newborn up to the age of 3 years at a newborn is done by pediatricians. It is very, very important and later by primary care physician, as I said, during the vaccination history. It is very, very important to know the history of the child, the birth weight, the antenatal history, if there is any family history of any problem, to check the vision and by visual contact, if the patient have child have a visual contact, and fixation through a smooth pursuit movement. The corneal light reflex to detect any ocular alignment, also with the cover and uncover test. It is very, very important to check the red reflex, which can give an indication on the refractive error and the presence of any leukocoria. Examination of the eyelid, pupil, and the cornea, and detection of refractive error by using the refractometers or the handheld one, or the photo screening. Eye screening from the age of 3 to 4, here we can detect the visual acuity, and at the same time we can detect the binocular single vision by simple test, red and green test, and also by stereopsis. At the age of from 4 to 5 years, the child will be more cooperative, and visual acuity will be very, very important in at this age, and we should repeat this test every 1 and 2 years. Now, for photo screening, it is a very innovative tool to facilitate the vision. Actually, it is sometimes it can be better than vision testing in children. And there is a special camera or video equipped with the facilities to detect the red reflex and the corneal reflex. And these images can be interpreted in the form of, to detect the refractive errors. It is an option to facilitate the screening, especially in the preschool children, and can have false positive or negative results. It's important also to know the risk factors for amblyopia, which usually in the premature birth, with the gestational age below 28 weeks or less, and the low birth weight less than 1,500 grams, and the first degree relative with the history of amblyopia or strabismus, children with the developmental delay or any other syndromes or neurological defects or disorders, the presence of environmental factors. Maternal smoking is one of the factors that can cause amblyopia, and also the use of drug or alcohol during pregnancy. Now, in conclusion, amblyopia is an important public health problem because of its prevalence among children. Early recognition and prompt referral is crucial, especially during infancy and childhood, to prevent permanent visual loss. Photo screening offers a hope in improving vision screening rates in infants, preverbal children, and those with developmental delay. Screening protocols is important to facilitate the identification of children with common vision problems when treatment will be more effective. Thank you.